Let me tell you about a retired teacher named Carol from Indianapolis, Indiana. Carol turned 65 in March. She had been covered under her husband's employer health insurance for years and assumed she could stay on that plan a little longer before dealing with Medicare. She figured she had time. She was wrong. When Carol finally went to enroll in Medicare Part B 8 months after her 65th birthday, she had missed her enrollment window. She was assessed a permanent penalty, 10% added to her Part B premium for every year she had delayed. That penalty does not expire. It does not go away after a few years. It follows you for the rest of your life. At the 2026 Part B premium of $185 a month, Carol's penalty adds over $18 to her monthly bill, permanently. Over a 20-year retirement, that one missed deadline cost her more than $4,000 in unnecessary premiums. Carol is not alone. Every year, hundreds of thousands of seniors make Medicare mistakes that lock in higher costs permanently. Not because they are careless, but because Medicare's rules are complicated, and nobody explains them before the deadlines pass. Today, I am going through 5 specific mistakes that are costing seniors thousands of dollars in 2026. For each one, I will tell you exactly what the mistake is, what it costs, and what you do to avoid it or fix it. Stay until mistake number 4, because that one has nothing to do with enrollment deadlines, and it is quietly costing seniors who have been on Medicare for years without knowing it. Medicare rules, premiums, and plan options change every single year. This channel breaks down every update in plain English before it costs you. Subscribe and let's get into it. Mistake number 1, missing your enrollment window and paying a permanent penalty. When you turn 65, you have a 7-month window to enroll in Medicare. 3 months before your birthday month itself, and 3 months after. That is your initial enrollment period. Miss it without qualifying coverage elsewhere, and the penalty is 10% added to your Part B premium for every full 12-month period you delayed, permanently. At the 2026 standard Part B premium of $185, a 2-year delay adds $37 to your monthly bill for the rest of your life. Over 20 years, that is nearly $9,000 paid for nothing. But here is where most people get caught. There is an exception for people still working and covered by an employer health plan. And that exception comes with 2 traps. The first trap is COBRA. If your employer coverage ends and you elect COBRA, COBRA does not count as qualifying coverage for Medicare purposes. Your enrollment deadline clock started when you lost the original employer coverage, not when COBRA ends. Many seniors assume they have until COBRA runs out to enroll. By the time they find out otherwise, the penalty has already attached. The second trap is retiree health coverage. Many people who retire with employer-provided retiree benefits assume that coverage protects them from the Medicare deadline. In many cases, it does not. Whether your retiree plan qualifies depends on the specific plan. Assuming it does without verifying is a risk with permanent consequences. Before you make any decision to delay Medicare enrollment, call 1-800-633-4227 and verify your specific situation. Do not guess. The penalty for guessing wrong never goes away. Mistake number 2, auto-renewing your plan without reviewing it. This mistake does not come with a penalty notice. It just quietly costs seniors money every year, automatically, without anyone pointing it out. Every October 15th through December 7th, Medicare holds its annual enrollment period. You can switch plans, change drug coverage, or make other adjustments. Changes take effect January 1st. If you do nothing, your current plan auto-renews. Here is the problem. Medicare plans are not static. Every year, plans update their premiums, their deductibles, their drug formularies, and their provider networks. The plan that fit your situation in 2023 may have quietly become a significantly worse deal by 2026. Your medications may have moved to a higher cost tier. Your doctor may no longer be in-network. Your premium may have gone up while a better plan sat available at a lower cost. Research consistently shows that seniors who review and switch Medicare plans during annual enrollment save hundreds of dollars per year compared to those who auto-renew without looking. What you do about this one. Every October, when your annual notice of change arrives in the mail, read it. It shows exactly what is changing in your plan for the coming year. If something looks worse, compare your options at Medicare.gov or call your free local SHIP counselor, State Health Insurance Assistance Program, before December 7th. Do not let the window close without looking. Mistake number 3, choosing a plan based on premium alone. This mistake is made most often at the very beginning, when someone first signs up for Medicare and is choosing between Original Medicare and Medicare Advantage. A zero-premium Medicare Advantage plan looks very attractive on paper, but premium is not the only number that matters. Medicare Advantage plans have networks. Your specialist may not be in it. Your preferred hospital may not be covered. And Medicare Advantage plans have out-of-pocket maximums that can reach $9,350 in 2026 for in-network care. If you have a serious health event, that is what you could owe in a single year. Original Medicare, paired with a Medigap supplemental plan, typically offers more predictable costs for seniors with significant health needs, even if the monthly premium is higher upfront. There is no universal right answer, but the answer for your situation requires looking at more than just the monthly premium. Your doctors, your medications, how often you travel, whether you might need care at a specialized facility. Get free help from a SHIP counselor, or use the Plan Finder tool at Medicare.gov before you decide. The difference between the right plan and the wrong plan is not a few dollars. It can be thousands. Mistake number 4, paying an IRMAA surcharge you can appeal. This is the one that surprises seniors who have been on Medicare for years. IRMAA is a surcharge added to your Part B and Part D premiums if your income was above certain thresholds in a previous year. In 2026, if your income in 2023 was above $103,000 as a single filer or above $206,000 as a married couple, Medicare charges you more than the standard premium. The extra charge ranges from $70 to over $500 per month, deducted automatically from your Social Security. A lot of seniors see a smaller Social Security deposit and have no idea why. The answer is often IRMAA. But here is what almost nobody knows. IRMAA is based on your income from 2 years ago. If your income has dropped significantly since then, because you retired, because a one-time event like a property sale or Roth conversion temporarily inflated 1 year's income, because your spouse passed away, you may be paying a surcharge based on money you no longer earn. And you can appeal it. The form is SSA 44, available at ssa.gov or at any Social Security office. You file it, document your current income, and the surcharge gets reduced or eliminated. Seniors who successfully appeal get back anywhere from $70 to over $500 per month in lower Medicare premiums. If you are paying more than the standard $185 Part B premium and you are not sure why, log into your My Social Security account. Look at your Medicare premium breakdown, and if IRMAA is listed and your income has dropped since 2023, file Form SSA 44. It is one of the most valuable and least used appeals processes in the entire Medicare system. Mistake number 5, paying a premium that a savings program should be covering. If your income is modest, there are federal programs called Medicare savings programs that will pay your Part B premium for you entirely, every month. The most comprehensive version, called QMB, Qualified Medicare Beneficiary, covers not just the $185 monthly premium, but also your deductibles, co-payments, and coinsurance. For qualifying seniors, hundreds of dollars per month in Medicare costs simply disappear. The income limits are higher than most people assume. A single person with monthly income up to approximately $1,235 may qualify for QMB. There are two additional versions, SLMB and QI, that cover the Part B premium for seniors with slightly higher incomes. 1 in 3 seniors who qualify for these programs never applies. Not because they do not need the help, because nobody told them it exists. Call your local SHIP office or your state Medicaid office and say these exact words. I am on Medicare. I am on a fixed income, and I want to know if I qualify to have my Part B premium paid. That sentence starts the process. It costs nothing to apply. 5 mistakes, every one of them avoidable. Missing your enrollment window. Know your deadline before 65 and verify any delay with Medicare directly. Auto-renewing without reviewing. Read your annual notice of change every October and compare options before December 7th. Choosing a plan on premium alone. Look at networks, out-of-pocket limits, and your specific health needs before deciding. Paying an IRMAA surcharge on income you no longer earn. File Form SSA 44 if your income has dropped since the year Medicare is using. Paying a premium a savings program should cover. Call your SHIP office and ask whether you qualify to have your Part B premium paid entirely. Carol's penalty was permanent. That part could not be undone. But every other mistake on this list was still fixable from where she stood. She reviewed her plan. She checked her IRMAA status. She applied for extra help on her prescriptions, and she stopped paying more than she had to. The same is true for you. Whatever your Medicare situation looks like right now, there is almost certainly something on this list worth checking before another month goes by. Share this video with one person you know who is on Medicare or approaching 65, because these 5 mistakes are happening to real people right now, and none of them come with a warning from Medicare before the damage is done. Subscribe and turn on the bell. I will see you in the next one.